Fox 5 and Hot 97 present Street Soldiers with Lisa Evers.
I'm so glad you're joining us for this episode of Street Soldiers on Black men's health disparities. I'm your host, Lisa Evers. In this show, we're talking about the alarming health disparities faced by Black men in America. This issue is front and center following the death of legendary hip-hop trailblazer Irv Gotti Lorenzo at the age of 54. According to the CDC, Black men suffer far worse health than any other racial group in America. Now new efforts are underway to raise awareness before it's too late. The National Institute of Health says the health of Black men consistently ranks lowest across nearly all groups in the United States. Former New York City Deputy Health Commissioner Dr. Torian Easterling is working to change that. With the nonprofit organization Heart, Body, and Soul, he's raising awareness in underserved communities through direct outreach and special programming.
When we look at our data, we do see preventable diseases are the leading cause of death among Black men. And the concern is that these are diseases that are avoidable, right? And so we're talking about leading cause of death of heart disease, cancer, even things like accidental and intentional injury.
Entertainer extraordinaire Rip Michaels is a comedian known for his hilarious sold-out comedy shows and for starring in Nick Cannon's Wild 'N Out, among many other performing and producing credits. His nonstop lifestyle of filming, touring, and performing came to an abrupt halt when he suffered a heart attack that threatened his life. He learned he had a congenital heart defect and would need a heart transplant.
To have to take all these medicines and to have to keep constantly going to the doctor's office and to keep constantly have to weigh myself every day, it's changed so much. And I want to thank that, God and for giving me the strong will to say that, every second I appreciate now.
Co-founder of the Murder Inc. record label and entrepreneur Chris Gotti Lorenzo said his final goodbyes to his younger brother Irv Gotti just days before he spoke with us. Irv's legacy as a groundbreaking hip-hop music producer and label executive is well known. Now Chris is determined to put purpose to the pain of losing Irv and raise awareness about the need for Black men to take better care of their health, especially those suffering from chronic diseases like diabetes, which Irv struggled to control. He also suffered from 2 strokes, the last one fatal.
He understood his challenge and couldn't figure it out exactly what to do. And he said it. He said he loves eating food and things and that's the challenge of this diabetes and the stroke. You have to really make life-changing decisions.
Clem Lawson is owner of the Level Up Fitness Studio in Fort Lee, New Jersey. He says lifting weights and working out is not enough. To be in your best health, you must focus on your diet.
Let's reprogram ourselves and look at our nutrition first. That's where everything starts.
We have an amazing panel to talk about this important issue from every angle. Let's get right to it. Joining us is Clem Lawson. He's the owner of the Level Up Fitness Center in Fort Lee. Clem, great to have you with us again.
Thank you, Lisa.
Thank you very much. Also with us is Dr. Torian Easterling. He's a physician and public health expert. Dr. Torian, thank you so much for being with us.
Thank you for having me.
We appreciate it. Also with us is Chris Gotti Lorenzo, the co-founder of Murder Inc. and an entrepreneur. And Chris, I just want to extend my condolences and all of our condolences here at Street Soldiers and Fox 5 to you and your family. We really appreciate your courage and speaking out through your heartbreak to try and make more people aware of this issue. So thank you so much for being with us.
Thank you, Lisa. Thank you.
We really appreciate it. Also with us once again is the entertainer extraordinaire, my favorite comedian, the one and only Rip Michaels. He is on a heart transplant list and still is doing his thing, entertaining people, trying to maintain a schedule while also a full-time job, just maintaining his health. Rip, thank you so much for being with us. We're really glad you could be here today.
I am glad as well. I finally had the heart to do the show, so there we go.
Rip, first of all, are you still in that whole daily routine that you have to go through just to maintain your health and stay alive?
Yes, I am. And it has been a huge ordeal. And I'm just blessed to not be in a hospital bed doing it and to have a little bit more mobility than I had because, I was in the hospital for like almost 2 years. So it does feel good to be home again. I know my family is so happy to have me more home. So I'm just, hanging in there.
Good. Well, you hang in there. We're glad you're hanging in there with us and talking with us about everything. Dr. Tori and Easterlina, let's start with you. When we talk about health disparities, this overall issue, these numbers are shocking. What are we really talking about here?
Yeah, they are shocking. I think it's important to define the term, why we see health disparities. And so when we're talking about health disparities, we're saying there's a difference in health or healthcare access between two groups. You talked about we see higher rates of diabetes, higher rates of hypertension, higher rates of stroke in Black men versus white men. But what is often missed is sort of the context, right? And so when we're talking about health disparities, we're also clear that this isn't driven by biological or genetics. There is some part of it, but mainly what we're talking about is linked to social or economic or even political factors. And so the question that we have to be asking ourselves is what's really driving these differences, and what can we do to really address them?
No, thank you for explaining that. Chris, you're the reason really why we are doing the show, because you spoke out just soon after you lost your brother about the need for greater health awareness and people to pay attention to it. What motivated you to go public with this so soon while you're still, in deep grief?
Well, we'll probably be starting a foundation on Irv's behalf, and probably my father. I'll include him as well. Both had diabetes, and in complications, I always like to say, like, no one's really, they don't die from diabetes. You die from the complications of diabetes and what happens to your organs or other parts of your body. And that was the determining factor of why, I was very close with my brother, and going through this whole ordeal was almost a 3.5 year time frame that just his health was upside down. And it just happened really fast, like from nowhere. And it's just the awareness, in my opinion, could have been a different outcome.
Plum, you work with a lot of celebrities that we've seen. What do you see happening with the clients that come to you, and what do you recommend to them?
I always come from a premise of just talking to myself first, because I'm not above having any issues that my clients also have. I'm 45, I'm a Black male, and I say this all the time, and I know we hear it: prevention is always better than cure. And oftentimes we will wait until it's too late, or we'll wait until we start to have symptoms to go to the doctor. So first and foremost, education is necessary. Secondly, we need to have like a benchmark of where we are with our health. That means understanding where your visceral fat is, understanding what your blood sugar levels are, understanding if you're pre-diabetic. There's a reprogramming that has to happen so that your nutrition and the training matches, and that your lifestyle choices also are lifestyle choices that are going to promote better health, not kind of shoot yourself in the foot with your health and then chase the better health later on.
There's more to come. Stay with us.
Working out, everyone's not designed for it. Some are, some aren't. They have to break that mindset. It's all mental.
Dr. Torian, I want to ask you, is it wrong for us to single out Black men when we talk about health disparities? Because aren't these things that everybody should be doing?
Yeah, absolutely. I think the messages that we're talking about today are germane to everyone, no matter what your age is, no matter your gender. But there is something specific about why we're seeing these inequities, these differences, right, among Black men, and that deserves a spotlight. But I think that there are some myths, right, that are out there that we just need to address. As a physician, I have served and taken care of Black men. What I always push back on this narrative is that Black men do not care about their health. I think we have to stop that narrative. It is really detrimental to our community. Black men are showing up, but we certainly want more Black men to be more engaged in prevention and not waiting till the end. I think there is also another myth around there is that, that Black men can tolerate more pain. This is why they are not showing up to see their physician. That is so untrue. Couldn't be farthest from the truth. Whether you're talking about mental health, whether you're talking about physical health, everyone is dealing with pain and struggles and trauma differently. And physicians have to be culturally competent. to ensure that they're tailoring their preventions and their interventions.
Stress is one of the main things, in my opinion, that affects health. Absolutely. But, our diet is probably number one. And in these cases, diet is everything. And then when we talk about the historical side of the Black man and not taking care of himself, we was just always in bad positions. Good eating is costly, it's expensive. So I come from nothing, right? My dad, we didn't have anything. So at the end of the day, his mindset, it was just really getting through it, put something in your belly, whether it was good or not, it was what you did. And that is part of why that narrative of the Black man not taking care of themselves, it really stems from where we started, and where you came from, and then not having the proper food. When I tour, I have a company, Adventure Music. We tour for independent artists to teach them how to own, operate, monetize. And when I tour around this country, when I'm in the hoods in USA, it's exactly the same blueprint of food. You can't find a Whole Foods or something good to eat. You have to travel so far to get it. It's the exact same fast foods and cheap foods that you are eating and consuming. So what else do you expect? Now it takes the smarter, more educated man, white, Black, whatever, to say, we got to change this habit. But it just maybe affected the Black community more because we was more of the have-nots.
Rip, you've shared with us on Street Soldiers throughout the years your journey from changing your diet and what you had to do when you first really had to get serious about it. You're touring all around the country. On the road, it's very hard because you got long hours. You finish, you're starving, and there's something right there that you can grab for not that much money that's open 24 hours. Tell us about that.
I guess the hardest part is that you got to kind of, make choices that, when you go in the gas station, you're going to have to carry your own green apples. You're going to have to stop on your way from the airport and make these changes. Because I was, diagnosed with congenital heart failure, which means that no matter what my diet was, it was something that was predisposed from my father. And in the whole process in the last 2 years, I'm diabetic now. I had a seizure. I had a stroke. My kidneys end up failing on me because when your heart's not pumping blood, a lot of these things just start failing and ailing. And for a whole 2 months, I couldn't even see anything. I completely lost my vision because my sugars were so high. So in all these different things, it lets you know how important your life are, and you have to go to the doctor. You have to go get checked because we'll walk around thinking we're fine and we won't even know. I literally hopped out the shower, and next thing I know, I woke up 4 days later in the hospital in the emergency room, and I just went into a coma, a diabetic coma. And those are things that I didn't even know, and I thought I was doing the right thing. So it's very important to get yourself constantly checked out.
Oftentimes, what people miss is that the doctor, more times than not, a good doctor, is going to tell you that movement is medicine. A good doctor is going to tell you to get more active in your lifestyle and change your nutrition so that you don't have to go to the doctor to now fix or correct something that oftentimes is self-inflicted. We are indulging in so much bad food on a regular basis, whether we go out to eat it or whether we're calling it in from DoorDash or Uber or whatever it might be. We're doing it in small increments every day, and then thinking that the doctor is going to undo the culmination of what you do 365 days a year.
Chris, people look at you and Irv, obviously, the huge figures in the hip hop community. People think, well, if Irv Gotti couldn't get the best medical care, he still had to go through this. What do you say to that?
Food is an addiction, and just like anything else that's an addiction, you crave it. It's very challenging in a normal day for a regular person, yet alone someone who's super successful like my brother was. Okay, I'll give you a quick story. His first stroke, I fly to LA. As soon as he had it, I'm by his bedside. He's not doing well at all. And when he finally starts coming through and coming back to himself, he's waking up out of his sleep asking for juice. Okay, if anyone knows that apple juice, Martelli, it's like syrup. It's all sugar. When I see him waking up out of his sleep, out of a cold sleep, yelling for juice, he wants some juice, that shows you the addiction of what we're talking about. It's no different if it was a pork chop, if it was a steak, whatever it is, that's the addiction. Our body starts craving things that we love and enjoy, and that's the addiction.
Dr. Torian, what about the diet? Like, how important is diet to all of these health conditions?
Yeah, diet is important, but it's all about consistency, right? So it's not going to be a focus on, hey, I'm going to try some diet fad and try to stick with it for 6 weeks, and then I should see the changes, right, in a month or two, right? It's really about consistency. So it's really about trying to find the right, sort of the right approach for yourself.
Rip, what about with your journey? How did you lock into the medical care that you're receiving now?
I grew up like Gotti was saying in the environment where you drink some Robitussin, put some Robitussin on it, get it,
Tussin on it.
put some Tussin on it. I'm just sitting here. I'm just sitting here right now. This now because of that. This is my daily routine. This is 1. This is 2. This is 3. This is 4. This is 5. This is 6. This is what my life consists of now. And it's because of the poor choices that I made throughout my life. And then again, I'm waiting for a life organ. A lot of people don't understand what that means. Is that someone, when you're waiting for a life organ, my heart is only at 20%. So right now I'm waiting for someone to aspire for me to live. And it puts you in such a dark place of like hopelessness. And when I was laying in the bed, I was like, and thank you for all my fans, and thank you, Lisa, for everybody that was just, praying me on. Because those things, when you start playing over your life and all the things you done wrong and all the things you could have done and all the knowledge you wish you had. Like, I wish I knew I had congenital heart failure. I wish I knew my dad had a bad heart and he passed it down to me. It just puts me in a thing where I'm trying to just be hopeful and positive every day and they're telling you, because it's just overnight. You really wake up and you don't know anything. I was literally going in for a right heart cath, and then they stopped because they realized my heart was too weak to continue. And I watched the doctors go from giving me advice and prescriptions to people praying with me on the side of my bed and going into CCU. So what I would say is you really have to take care of yourself. Like Clement said, you got to go to the gym. You got to get your mind right. You got to exercise. You got to make better choices. And you most importantly have to see a physician. You have to find out what's going on internally with your body.
Rip, in terms of people who hear your story, see your example, and they're like, boy, I don't know what I have, or I don't know what conditions I might be, going through, what do you say to them about your journey that you think might help them?
I think that accountability is everything. I mean, we're not going to change what's in our environment, so we have to make smarter choices. I would say start by something simple. Start by, instead of saying, you know what, I'm going to have white bread, I'm going to have a whole wheat. I'm going to have something that's a little bit more healthy. These small changes along the way and a little bit of exercise. It's as simple as just saying, you know what, I'm going to take the stairs today.
Right.
Yeah.
It's incorporating those things into the daily routine. Chris, what advice do you have for people?
You got to know what you could do. Everyone is different. We are like, again, I go to Flynn because working out, everyone's not designed for it. Some are, some aren't. They have to break that mindset. It's all mental. This is all a mind thing. It's a mental game we playing, whether it's diet or working out. It's really just quality of life. And if you want to live a quality life, if you have kids, you have loved ones, and you want to be there with them, this is really the choice, is just to make the right choice, to break whatever bad habits you might have. We are product or creatures of repetition, and we create habits. And if we have bad habits, to get out of those things.
And Plum, that's kind of your message too, all along, right?
So the level up to me always starts mental. So that's why I always talked about the reprogramming first. The reprogramming is about having discipline on a daily basis, to press reset every single day, to honor yourself. It's about honoring yourself, to say that this is how I'm giving back to myself. The movement is going to help me get stronger so that I can sustain my life.
Torian, in terms of our awareness, what do we need to do moving forward?
We talked a lot about personal responsibility, self-accountability. I think is really important. The other key point, and it has been a key part of my work, is also trying to change neighborhoods. It is not that easy in Black and Brown communities, particularly across New York City. You look in the South Bronx, you look in East and Central Brooklyn, go to Harlem. Most of those stores, you got corner stores or bodegas, you have fried chicken, you have Chinese food. And so access to healthy food is not as easy as we think. We have to advocate to our local and our state lawmakers to ensure that access to healthy food, to ensure that even access to physical activity, right? There shouldn't be a choice about recess and making sure that our kids are moving during the day. These are lessons that we should be carrying with us. So yeah, when we get 30 and 40, it is improving our quality of life. We have to introduce these things at a much early age.
Thanks for joining us for this episode of Street Soldiers on Black men's health disparities. You can watch it again on our Fox 5 NY YouTube page and the Fox Local app. Remember, use your mind, it's your best weapon. I'm Lisa Evers. Let's push for peace, love, and good health for all.